Good evening, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. What is common to all of you? Number one, you're all brilliant kids. Because we are medical students, we are super race, like Germany, super race. Number two, what is common to all of you? You all are short of time. All of you are only 7 days before exam. Nobody has a special time created for them. Number three, what is another unfortunate thing common to all of you? You all have abundant notes, books. Suddenly you are becoming ambitious to become a topper overnight, right? So the third is the major problem. Why? Just before Kaushik was asking me, sir, so many surgeries, shall I read the type of surgery and all those funda? Impossible. If you know prostatectomy is done for prostate, that is enough. If you think that radical prostatectomy means it is still done only on prostate, you don't remove bladder, just because it is radical, that is enough. So I understood one thing. Anybody can give you coaching. Anybody can give you long term. Anybody can give you abundant notes thrown on your face. But the real need of a good teacher is at this last 7 days, where knowing that my kids are having trisomy 21, along with ADHD, along with autism, तारे जमी पे, right? So we'll run one exercise. What is our hypothesis? 50 are dumb questions. You don't prepare also, you will do it. 50 are creepy questions. They come once in a meteoric time. 100 are standard issues examiner want to know from you. The real competition is how many people answered those 100 out of 100 while answering 50 and saying no to the stupid 50. Clear? Once we analyze 2022, 21, 20, 19, 18, bus, 5 papers. Because the criteria of stupidity was different 5 years before. Even examiner will have cycles of insanity. So that's the reason that can either udhar badal. Then we have 5 into 2, 10 papers of INI, CET and AIMS. So that 2000 here, how many thousand? 3000. In this, 50% are standard topics. That means out of how many I said? 1000 plus 2000. 3000 may 50% means 1500 questions we are going to identify that they are from standard topics. Then our proposition is out of these 1500 questions, it should not be more than 300-400 standard topics from which questions should come. Let us do that countdown in the next 5 days to come. You all are with me? Yes. What you need to do, taking pen and paper, is what is this common topic? I will tell you what is common topic, what is stupid topic, and third, already you know what is otherwise a chiller topic, chiller question. Okay? So just let us do that analysis. Make a note of the topic that you need to go a little more detailed. Let us do this simple exercise. That is the only best thing we can do in the next 7 days to come. Will you all agree with my logic, Shivanarayan and everybody who is all online? Most important, be cheerful. World is not going to end in another 1 week. There are many beautiful things to do in this world. Let us start. Most common complication of this condition if untreated. So fundamentally, it is a non-union of the lateral epicondyle, which lead to cubitus valgus. So typically, whenever there is any lateral humeral condylar fracture, which is not being treated appropriately, it can lead to development of cubitus valgus. Is this the standard topic? Supracondylar fracture is the standard topic, so-called more standard. Still, this lateral humeral condyle leading to development of cubitus valgus and tardy ulnar palsy is a known topic. इसलिए लिख लो कितना टाइम स्पेंड करोगे 2 minutes on lateral humeral only this cubitus varus and also ulnar nerve injury. अगर मुझे बोले तो मैं पढ़ता भी नहीं क्योंकि last year only it was asked. Now what is this device? Stupid question. Even MS Orthopedics guy only can answer. Kachra, take it and put it in dustbin, it won't come. Patient developed dyspnea and breathing 2 days after admitting in the hospital. Fat embolism, chiller question. Don't write anything. If it is chiller, don't write it. Only write what you need to. 40-year-old comes to the hospital with the X-ray hand. There are multiple enchondromas. Enchondromas. So fundamentally, this is a chiller question because bone tumor is a standard topic. One MCQ on bone tumor, without that there is no orthopedics question bank. Remembering Mafuki syndrome, right? And enchondroma, you're supposed to know, but this is not tough question. If you know that bone tumor enchondroma is a standard topic, you will answer. The disorder with multiple fractures of long bones can be identified in which condition? Osteogenesis imperfecta. ये भी चिल्लर है क्योंकि you know that there is only one syndrome that associates with multiple fractures. This is not a very standard thing. Right? A patient came to the clinic after falling on the left shoulder with the pain, and he is holding the left hand in the flexed position. Proximal humerus, because they have an axillary nerve injury. Right? So now, humeral fracture, please make a note. Axillary nerve injury, standard topic. One or the other format of that he will ask. बराबर? अभी तक कितने टॉपिक्स आ गया?
Supracondylar fracture, bone tumors, humeral fracture, axillary nerve injury.
Bone tumor and
Humeral fractures.
humerus fracture, axillary nerve injury.
At what level of fracture, what nerve is getting injured?
Bone tumor is very big topic. Usko don't consider that. I will tell you what to consider. I mean, bone tumor, otherwise you keep it as this thing. Maximum you will take 10 minutes to read bone tumors.
Just to know which comes where. What
Correct.
looks like what? Classical science.
Correct. I gave you already in the notes. Maximum 2 pages दिया होगा my bone tumors के बारे में. बस. A male child is being history of URTI, a light occlusion in the lower end of the femur, peripheral smear is being shown to you, and typically it is salmonella infection in sickle cell anemia. Chiller question. Don't tell osteomyelitis. Chiller question. Right? Anybody will answer. वहाँ के वो देख के salmonella बोल के. What is the ideal treatment with following X-ray? How do you manage? What is this? Fundamentally, it is a Galeazzi fracture. This is a stupid question. This is a what you call as red light kind of a question. I mean, examiner is luring you on some common sense thing. Not red light question. You can call it as a what you call as a biscuit question. I mean, fundamentally, what you need to do with Galeazzi and what is that called? Monteggia fracture. Okay, लिख लो. Galeazzi, Monteggia, एक बार. But whenever we read Galeazzi, Monteggia, no, generally we don't focus on treatment part. मगर यहाँ क्या हो गया? Treatment के बारे में बोला. But still, that is the fix. Intravenous botulinum toxin mechanism, standard topic. Botulinum, लिख लो. Botulinum toxin, Clostridium toxin, tetanus toxin. ये तीनों का हम पढ़ के ही जाना पड़ेगा. बराबर? Very good. So, you just not writing. You are going to share it in the WhatsApp group. Make it a point. Right? उससे कुछ भी नहीं होता. Next, देखो acetaminophen overdose में acetylcysteine. All antidotes in poisoning is a standard topic. Flumazenil, benzodiazepine, fomepizole, methyl alcohol, right? And alkaline diuresis कहाँ करते हो? Acidification of urine for which toxins? How do you manage tricyclic antidepressant poisoning? All poisons and antidotes. Make it a point. Standard question. इसमें टेंशन कुछ भी नहीं है. Throbbing headache, left sided, nausea, vomiting, photophobia, Sumantripta. Migraine, cluster headache, tension headache, headache is a standard topic. Patient ingested digoxin accidentally, heart rate is 54. ECG is being showing what is the immediate management. Digoxin immune fact. Digoxin toxicity, standard topic, examiner is expecting. So remember, tricyclic antidepressants, digoxin, lithium, invariably one question is going to come. One of these three. Standard है. अगर ये मैं एग्जाम को गया या आंसर नहीं किया बोले तो even an ant also will care about your crying. Right? Now, 82-year-old episode of shortness of breath. History reveals uncontrolled hypertension. What is the management? What you are seeing here fundamentally, pulmonary edema, acute episode, uncontrolled hypertension, what do you want to give? So you need to give nitroglycerin. Hypertension management is a standard topic. Drugs inhibiting pro-protein convertase subticillin kexin type 9 इसको क्या बोलते हैं? Red light area question. You know the answer because we discussed this earlier. मैं आम आदमी के लिए बोल रहा हूं. But okay, ठीक है, रेड लाइट में डिक्लेयर मत करो. मोनोक्लोनल एंटीबॉडीज का लिस्ट मैंने दिया ना, स्टैंडर्ड क्वेश्चन में डालो. Once more, our students are wondering, ये क्या सेशन चल रहा है? So please remember, three classes of questions in every NEETPG. 50 और बिस्किट, इसको हम दूसरा नाम दिया है चिल्लर. 50 और रेड लाइट एरिया. बाबूजी आओ ना, कमरा खाली है. So this is what 50 चिल्लर. इसको ट्राई करें तो HIV आएगा. नेगेटिव मार्किंग के में डूब जाओगे, टच नहीं करना. 100 स्टैंडर्ड, लाइक दीपावली को स्टैंडर्ड टपाके है ना, वैसा. हम क्या समझना चाहिए, हमारा प्रिपरेशन 50 के लिए नहीं बिकॉज वो बिस्किट है, ये तो इम्पॉसिबल है. सो हमारा बराबर कौन होता है? Mama's daughter, who will not say no for marrying you, right? So even with or without marriage, it's okay for her. So that is 100 standard questions. अगर यहाँ कुछ गड़बड़ हो गया तो you won't get seat. So how do we recognize these 100 standard topics? Maximum will come from around 400 topics. Still we have 7 days time. So what we should do? We should know what are the 400 possible topics in the next 7 days. At least per day 50-60 topics को revision कर देना. So what is the diagnostic time? Evening, 4-5 hours with Murli. What is the therapeutic time? Morning. Before I come, you should say, sir, कल का 40-50 topics हमने खत्म करके बैठे हैं. But 7 days is enough for preparation. You don't need more than that. Now, patient presents with pituitary tumor overproducing growth hormone. So what is the growth hormone antagonist? Octreotide. This is a chiller question. Anybody knows this. This does not fall into a topic. Don't write it. It doesn't fall into a topic. Acromegaly is a topic, but it is not a topic worth revising because we know all that
That way,
in
yes.
acromegaly.
Acromegaly, the larger for the treatment is orthodox.
That's all. 40-year-old presents with excessive sweating, impaired glucose tolerance, etc. Once more, what is the growth hormone antagonist? Pegvisomant. Standard.
Two questions which is
This is no. This is biscuit. This is known. एंडोक्राइनोलॉजी के फार्माकोलॉजी है ना, उसमें ऑलरेडी डिस्कस्ड एंड छोड़ दिया. 40-year-old diabetic female who is presenting with decay, how do you want to manage?
IV,
Regular insulin. Decay is a standard topic.
IV fluids,
IV fluids नहीं, decay.
DK, yes.
हाँ. And decay के साथ क्या है? All types of oral hypoglycemics, types of insulin, वो सब पढ़ना पड़ेगा आपको. A female presented with galactorrhea, urine pregnancy is negative, patient refused to undergo surgery. What is the next best step? Bromocriptine. Prolactinoma, pituitary tumor. So, bromocriptine is one of the known and standard topic. लिख लो, standard में लिख लो, bromocriptine. And Parkinsonism drugs लिख लो. Parkinsonism drugs जरूर आएगा, उसमें डाउट इच नहीं है. ओपियाइड पॉइजनिंग में नेलॉक्सोन एंटीडोट्स ऑलरेडी आपने लिख लिया. TVT में patient was started an oral anticoagulant and she developed this. What is this? Because of warfarin. आप लिख लो स्टैंडर्ड टॉपिक लिस्ट में कंपलसरी आने वाले में 3 टॉपिक्स गर्मा गर्म पढ़ना. एक thrombolytics, streptokinase, urokinase, TPA, everything. Then anticoagulants, उसमें से warfarin, rivaroxaban, dargatroban, everything anticoagulants, बराबर. Then antiplatelets. एग्जामिनर छोड़ेगा नहीं, आप देखोगे ना पूरा कितने पेपर्स 5 नीट पीजी और 10 एम्स आईएनए सीटी में देख लेंगे, मिलेगा. इसका नोट्स ऑलरेडी अवेलेबल है. ये ऐसा नहीं है कि वो खाली हमारे नोट्स में मिलेगा, सबके नोट्स में मिलेगा, टेंशन नहीं है. Patient with COPD was given aminophylline therapy, developed diuresis. What is the mechanism of aminophylline? So asthma drugs लिख लो, कंपलसरी 1 आस्थमा ड्रग्स आएगा. वो कहां से है? एडिनोसिन रिसेप्टर्स के ऊपर काम करेगा वो. कल और एक पूछेगा, कल वो लाबा के बारे में पूछेगा, साल्मेट्रॉल के बारे में पूछेगा, राइट? और ही विल आस्क इप्रोट्रोपियम ब्रोमाइड इज गिवन इन COPD एज अ ब्रोंकोडाइलेटर. बट आस्थमा के ऊपर पूछेगा एग्जामिनर. ओवेरियन कैंसर सिस्प्लाटिन थेरेपी. After taking an antiemetic, he developed dystonia. Metoclopramide. So, antiemetics like ondansetron कैसे काम करेगा, metoclopramide कैसे काम करेगा. Antiemetics is in the standard topic list. आपको 15 मिनट से ज्यादा नहीं लगेगा. Then pregnant female with UTI on antimicrobials, baby developed tendon rupture and arthropathy. It is one of the side effects of fluoroquinolones. And what is the mother of all topics? Antibiotics. All antibiotic classes, their mechanism of action and what is their side effects. ये जो है ना स्टैंडर्ड टॉपिक है एग्जामिनर के लिए. कल पूछेगा भाई हाउ डज सिलास्टिन वर्क, वे हाउ डज इमिपेनम वर्क, हाउ डज टेट्रासाइक्लिन्स वर्क, एमिनोग्लाइकोसाइड्स वर्क, ऑल दैट ऑलरेडी वी डिस्कस दैट. एक मर्तबा गर्मा गर्म पढ़ना है, कल के नीट पीजी में कुछ भी आएगा भैया। एमडीआर टीबी के बारे में अगर मालूम नहीं है तो भारत में एंट्रेंस लिखने के लिए नालायक है हम। सो ए टी टी ए टी टी ए टी टी स्टैंडर्ड टॉपिक, everything about the ATT. How do you define MDR TB? How many drugs का resistance है तो all those things, you know, multi-drug resistance, extensively drug resistant, mono-resistant, poly-resistant, everything. Are you catching cold? No, no. AC వల్లనా బంద్ చేశారా? So patient presented with this ECG. Which drug was used to treat this condition? So patient is having hyperkalemia. So that is the reason beta agonist can be given. So हमने क्या बोला? Standard topic लिख लो. Hyperkalemia, hypokalemia, hypercalcemia, hypocalcemia, hypermagnesemia, of course. अगर एनर्जी है तो हाइपोमैग्नीसीमिया, हाइपोनेट्रीमिया, हाइपरनेट्रीमिया। कितना हो गया? 1 2 3 4 5 6 7 8। ये 8 टॉपिक्स को पढ़ने के लिए कितना रहता है? 8 into 5 minutes, हाफ एन आवर, 30 मिनट्स ले लो, मगर पढ़ो। नोट्स दिया, कॉजेस दिया, कल के एग्जाम में कुछ भी नहीं, नथिंग स्पेशल विल बी देयर, राइट? सो which drug has an adverse effect on pleura? Metformin. This is too much. Least adverse effect on pleura. Bromocriptine, nitrofurantoin, methotrexate, all of them lead to pleural fibrosis. मैंने आपके नोट्स जो दिया ना उसमें all every system में in the notes I gave you, लास्ट में ड्रग्स दिया ना फार्माकोलॉजी में, नो फार्माकोलॉजी में नहीं दिया। GIT रिव्यू, हेमेटोलॉजी रिव्यू, oncology रिव्यू, एंडोक्रिनोलॉजी रिव्यू, रूमेटोलॉजी रिव्यू, इसमें लास्ट में ड्रग्स दिया ना, पढ़ना उस नोट्स में जो मैं दिया है आपको, बिकॉज दैट विल कवर दिस बेसिकली। A patient on antitubercular presented to the clinic with tingling and numbness. Standard question है। विटामिन B6 deficiency, ये बायोकेमिस्ट्री में, antitubercular therapy में। Of course, you know that peripheral neuropathy is a side effect of INH, and to treat that we give pyridoxine. Is it any impossible question? No, हमारे आधे घंटे में हो जाएगा। See, totally how many system reviews I have given you in the notes? जरा first में बोलो, 1200 pages notes में क्या क्या दिया मैंने? Systems, cardiology, hematology, neurology, respiratory, reproductive, endocrinology, GIT, musculoskeletal, hematology, oncology, I already दिया ना। ये कार्डियोलॉजी हेमेटोलॉजी छोड़ दो, ये जनरल मेडिसिन वाला है। ये हेमेटोलॉजी, रीनल, हो गया ना? So how many totally? Neurology, respiratory, 1 2 3 4 5 6 7 8। 8 में last 3 pages in the notes which I gave you, 8 into 3 is equal to 24 pages अम्मा। निद्र लेवंगाने next 7 days हनुमान चालीसा के जैसे पढ़ लो। भूत प्रेत पिशाच शाकिनी ढाकिनी दूर रहेगा आपसे। राइट? तो पंडित मुरली भरद्वाज बोल रहे हैं, सुन लो, simple preparation. How much time do you take to read this 24 pages revision? Hardly 1 hour. Daily 1 hour for the next 6 days. That almost will cover out of this 100 standard topics now. 10 खत्म हो जाएगा वही. What will effectively proven way to increase the lifespan? This is too much. एक क्या है? रेड लाइट एरिया क्वेश्चन. वो पढ़ने से नहीं होता. अगर आप ट्राई करें तो राइट हो सकता है, रॉन्ग हो सकता है, बट यू कैन टेक ए कैलकुलेटेड रिस्क टू डेट द कमर्शियल सेक्स वर्कर. Then comes pedigree of inheritance pattern. It's a standard one. लिख लो, inheritance pattern, standard topic. So fundamentally, it is an autosomal recessive. That's the reason it is cystic fibrosis in the list. Every NEETPG one question आएगा. Neutrophil extracellular trap, red light area. Sure, bakwas question. Nobody will answer this. If you want to get seat, don't answer. Touch them also. Kick them out. चिल्लर क्वेश्चन क्या बोलते हैं? अभी तक कितने आए? ऐसा 3-4 हो गया ना. नोट जे लेता पोल लेंगे. कचरा को भी नोट करें तो क्या मजा है. हाइपोक्रोमिक माइक्रोसाइटिक में आरबीसी काउंट इज 5.2 × 10⁹. व्हाट इज द मोस्ट सेंसिटिव investigation in this? Target cells are being shown HB and thalassemia. HbA1c नहीं, 8. thalassemia लिख लो. thalassemia, iron deficiency, sideroblastic anemia, anemia of chronic disease. पढ़ के जाना पड़ेगा, नहीं तो छोड़ेगा नहीं. बराबर. 56-year-old, high TLC, platelet count and hemoglobin, complaints of a dragging pain, massive splenomegaly. And what is the defect which is being shown to you? It is Philadelphia chromosome, right? And what is being shown to you? Metamyelocytes are shown to you. So AML, ALL, CML, CLL, HCL, Hodgkin's lymphoma, non-Hodgkin's lymphoma. कितना है? 1, 2, 3, 4, 5, 6, 7. सप्त महर्षि, 7 sages of hematology है ये. कितना देर लगेगा? 5 मिनट. Leukemia hour is how much? 5 मिनट, आधे घंटे. Am I too obsessive?
No.
Is it any new paper which we don't know? So preparation is not 7 days is enough if you come with an intact mind and confidence. That is important. Pseudo confidence है तो भी मुझे अच्छा लगेगा. Over confidence also अच्छा लगेगा. Problem is under confidence. आएगा या नहीं आएगा, क्या होगा मेरा जिंदगी. कुछ वीडियोस आते हैं ना यूट्यूब में, मेरे बेटे को कैंसर है, जरा पैसे दे दो बाबा. वैसा नहीं रहना. Go like a king, go like a princess to war, right? Wield the sword, make the best use of this little available time. देखो हमारे विनीशा दीदी को देखो, कितना कॉन्फिडेंस रहता है. कभी आप उसको टेंशन डिप्रेशन में देखेगा नहीं. डे आफ्टर टुमारो एग्जाम ना, इसलिए टुडे आई विल पार्टी एंड कम टुमारो. प्लीज भरत. So Bharat, this section is not for you. This is for trisomy 21. This is for trisomy 21 students. A face చూస్తే కనబడట్లేదమ్మా. He's a Buddhist monk. He's Lama. He's Bharat Lama. देखो, our original plan was to discuss like yesterday, but today as I stepped in, no, our क्या नाम है, कौशिक ने पूछा अरे కౌశిక్ నే పూछा సార్ రాడికల్ ప్రాస్టెటెక్టమీ లాంటి టాపిక్స్ లో how to plan for the surgical treatment, shall we give, not to give, all those decision making. Or నాయన ఏడునో నాయన అనుకున్నా. If you know prostatectomy is done on prostate, enough. So we started one new analysis now because Bharat came little later. 50 biscuit, 50 red light area, impossible. 100 Aam Aadmi. We are trying to recognize what is the pattern of examiner, what are those 100 topics that we should be expecting. Out of at least say 400 to 300 topics we prescribe now. Agreed? So we want to use the 5 into 2, 10 papers of INICET and AIMS and 5 papers of NEETPG. It is అవేపటికల్లా మనకు తెలిసిపోవాలి. Otherwise, don't become eager in this last 1 week to become Mahagyani and be an oncologist, rheumatologist, and all lodges. Patient underwent cystoscopy. Multiple yellow white plaques in bladder infiltrated the lamina propria. Malakoplakia, not a standard topic. 90% students 90% students don't ever heard malakoplakia. Why malakoplakia? 90% don't know what is leukoplakia also, and go to exam hall. Just before I went to Gandhi Medical College के बाजू में क्या भीड़ है भाई, मुझे टेंशन आया. They're all drinking tea and then, oh my God, lights, achievers batch and all that. All bullshit FOMO. कुछ भी नहीं कर रहे, वो टेंशन को कट डाउन कर रहे एक दूसरे से बात करके, right? Because preparation is not that tough. If it is that tough, fellows like us would have not cracked. Middle-aged male, and let me tell you, I was also like you. I am no saint, right? So middle-aged male with painless, slow-growing neck swelling, biopsy was done. And what is the examiner showing you? Outside. So what is he trying to ask you? Lymphoma malum hai kya? So do the FNAC for Hodgkin's lymphoma. Is it in our standard? That picture you can catch. Kada? Kani chadvali kada? Enduku kada? Because leukemia, lymphoma में इतना dense content है. At least 500 points will be there by the time Saptarishis. AML, ALL, CML, CLL, HCL, HL, and NHL. Identify the image. Islets of Langerhans. Red light area question है. Who will recognize it is Langerhans cells है? Lymphomas, lymph node सोचते हैं. Lymph node का दीदी. So, what will you do for this kind of question? मेरे पास नहीं आना, तेरे आंखें में, मेरे आंखें से दफा हो जा. So then 25-year-old edema NSR ka minimal changes is made. Enta standard చూడండి, చిల్లర్ క్వశ్చన్ బట్ స్టాండర్డ్. क्या what is the topic examiner के FSGS, MPGN type 1, type 2, minimal change disease, membranous nephropathy. At least 150 points है उसके बारे में. पढ़ो 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 पढ़ो, राइट? डेफिनेटली आए. आप देखोगे ना, हम 10 एम्स INICET एंड 5 देखते ना, 15 में ग्लोमेरुलोनेफ्राइटिस नहीं है तो मैं अपना नाम बदल दूंगा. उतना मालूम हो के भी हम एग्जाम को नहीं पढ़ के जाते, क्योंकि हम ट्राई कर रहे हैं एनरबोर क्लासिफिकेशन को चढ़ाने के लिए और रैंसम्स क्राइटेरिया चढ़ाने के लिए. चढ़ाओ मत, अभी चढ़ेगा नहीं, राइट? Take tequila shots, 1 shot enough, not 2 liters beer equal to 1 liter tequila. Tequila देते हैं अभी, beer पीना बंद करो. So doctor, it responds very well. Minimal change disease. Infertility, semen analysis show azoospermia, biopsy image was being shown. It is certainly cell only tumor. Red light area question. It's impossible. It's situational guess. Azoospermia means spermatogenesis. इसमें spermatogenesis is caused by Sertoli cells. By that logic, you don't need preparation for this. But red light में डाल दो. Don't tell testicular tumors are the favorite topic. But the question is, testicular tumor पढ़ने के बाद भी यहाँ Sertoli cells and azoospermia को link करे तो situationally answer कर सकते हो. ठीक है? 40-year-old with arthralgia, oral ulcer, joint pain, oliguria, hematuria, urine examination is showing granular cast is lupus nephritis. Second question on glomerulonephritis. One of the glomerulonephritis, lupus nephritis, wide loop lesions. Abo, you need to understand. एक नहीं दो आ गया. Hemoglobinuria, raised LDH, elevated bilirubin. What is typically, this is being shown with the cystocytes. Examiner is trying to ask you about Maha. So please remember, TTP HUS है ना? TTP HUS standard topic है. उसमें टेंशन कुछ भी नहीं है. Right? Next exam में वो पूछेगा. There was a history of dysentery following that the patient has developed elevated creatinine and also there is a hyperbilirubinemia in a small child. Think of hemolytic uremic syndrome. किसी और को altered sensorium है, cystocytes हैं, TTP. Reynolds pentod, HUS TTP చదవప్పా. ఇంకోటి రాసుకోండి, PNH, paroxysmal nocturnal hemoglobinuria. उसको छोड़ेगा नहीं एग्जामिनर. 40-year-old with pallor and fatigue, hemorrhoids, hemoglobin low, peripheral is being shown to you. It was actually microcytic hypochromic picture shown and asked you to identify iron deficiency anemia. Without looking at that smear also, you will answer in exam hall. No preparation needed. Because already iron deficiency anemia is a part of your hit list. Murray, ఎవడన్నాడండి NEETPG is difficult అని? చిల్లర్ exam. Provided you know where to cry. Right? Don't cry on unnecessary topics, some luxurious things, some strategies. No wonder will. Wonder is there inside you. God is inside you. Middle-aged female, COVID-19, because that time COVID was there. Abhi COVID hoga ya nahi hoga, doubt hai, but फिर भी. Which finding is seen on lung biopsy. But still, COVID may be eradicated in India, but COVID will be there in the examiner question bank for another 2-3 years. Jarra COVID ke bare mein, what drugs are used in COVID, etc. But does it need preparation? आपके हाथ में नहीं है वो. ऑटोमेटिकली आएगा, बाहर निकलेगा, गाना आएगा स्टेज के ऊपर गए तो. Stab wound to the right side of his abdomen, liver is suspected to be injured, and the investigation has been done. I told you, nowadays one stupid question is coming every NEETPG INICET paper, which is called thromboelastography. इसलिए kindly add it into your 400 topic list. इसके बारे में आप विकिपीडिया में पढ़ो मैक्सिमम. उससे ज्यादा कहीं और भी पढ़ने की जरूरत नहीं है. Different patterns will be there, and still if examiner want to test it, this is important. Itluntenemo normal, itluntenemo పొడుచుకుని వచ్చి hemodilution, this is fibrinogen deficiency. Itluntenemo low dysfunctional platelet, itluntenemo thrombosis. Somehow this entered into the examiner question bank. छोड़ेगा नहीं एक thromboelastography. 18-year-old male with chief complaint of recurrent epistaxis, completely occupying the posterior choana. Most likely diagnosis क्या है? Standard question है. Nasopharyngeal angiofibroma juvenile. So that is the reason always in the history क्या देखना? Male. It occur only in males, not in females. Got it? So लिख लो बेटा. Nasopharyngeal angiofibroma, standard topic in ENT. Alcoholic patient, white patches in oral cavity, what is the diagnosis? Nursing student also will answer. Leukoplakia or candida, erythroplakia, right? So this goes without preparation. Let me tell you. This comes under what? Biscuit. मैं बोल रहा हूँ. You are thinking, you are underestimating yourself. अब इसमें मेलियस इंकस्ट इसको कोई भी कोचिंग हेल्प नहीं करेगा. भरत तो तपेश्वर है. आपके लिए नेक्स्ट वो स्कैफाइड कैपिटेट लूनेट वो सब लगा के बताएगा बेटा ट्राइक्विट्रल क्या है. ఇది స్టిర్రప్ కదప్పా స్టేపిస్. This is either biscuit or chiller. I mean, it is chiller. Pain with increases with eating food. The X-ray image is being shown. This is red light area. Who will know it? It is fundamentally, if you can guess it is CLO-lithiasis, it goes without saying. Otherwise also, चलेगा. आप अभी बस निकल के आए और अच्छा क्या है भाई ये पहला क्या है वो क्या हो सकता है it doesn't fall into our 100 topic list. ఇట్లాంటివి ఇస్తాడు వాడు కొన్ని ముద్దు ముద్దు బొమ్మలు ఇచ్చి ఇది బ్లాడర్లు ఉందా లేకుంటే ఎక్కడుంది. So all of you lighten yourself and go to exam. That's what I want to tell you. Basilar membrane, high frequency hearing loss due to damage. Basilar membrane mein, it is typically closest to where? Fundamentally, this is definite standard question. Topic hai. Topic the standard hai. But you should be super smart student to know that how is the what you call frequency along the basilar membrane from the base to apex. Accordingly, which frequency get affected? Which frequency get affected? It's an advanced level question. Honestly speaking, I leave it into red light. Hardly this question would have been answered by 100 to 150. Cut down the crap, man. Don't tell me everybody interview पकड़ के बात करता है. कोई भी बुद्धा नहीं है. Come on. आंसर मालूम होने के बाद सब लोग स्टाइल मारते. So anyway, the point is, you should not do wrong on Weber-Rini. Weber-Rini వస్తుంది ఇప్పుడు కొన్ని రోజులు కొంచెం సేపు కాగానే వస్తుంది. కానీ ఇది కొంచెం అడ్వాన్స్ లెవెల్ అడ్వాన్స్డ్ ఐఐటి జేఈ ఏమంటే కాదా అన్ని కథలు చూద్దాం కదా రేపు పరీక్షలు. A child presents with fullness in ear, mild hearing loss and tympanic membrane is being shown. Identify the condition. Serous otitis media. Fundamentally, otitis media is, how can you go to the exam without knowing ASOM and CSOM and serous otitis media? If you are still going and expecting to become a topper, impossible. So standard ASOM, CSOM, all the surgeries associated with that, वो सब पढ़ के ही जाना पड़ेगा. Female comes to gynecologist after for hysterectomy, discusses the procedures, and she signs the form. Which type of consent it is? Completely red light question. Correct, ma? But the point is, consent पढ़ने से नहीं आता. Consent is not in standard topic list. आया, आप luckily correctly guess किया, but this is a calculated risk where you can go into the room. I'm talking to Bharat. Huh? So here you can try wearing a condom, but otherwise other locations you can't, right? So even if you wear condom, there is no guarantee. That kind of questions will be there. So then, doctor, a male is having alopecia, came to the hospital. His wife complains of behavioral abnormalities in him. In the nails also abnormal. So what is this? Poisoning. Thallium. So remember, arsenic poison, thallium poison, mercury poison,
The metal poisons first. All metal poisons.
typical very good. Metal poisons. ఇప్పుడు చదివేయాలి మీరు నైట్కి गुड़ गुड़ मन चलवाले कल एग्जाम में आर्सेनिक देता नहीं तो और एक इमेज देके मर्क्यूरी बोलेगा हम थके टीचिंग कर करके टीचिंग करने से कुछ भी नहीं आता और मतलब listening to somebody teaching will not make you recall. You need to read and absorb. Leading questions can't be allowed in.
Cross examination.
This does not need this not even a standard topic. This is supposed to be known when you passed your exam. ये आएगा. Identify the wound in image. It's a defense wound. ఇప్పుడు రాసుకోండి. Wounds in forensic. Wounds in forensic. Suicide versus homicide. Standard topic. So because the person will try to avoid a homicide, he will keep the hands in the middle, then the defense cuts on the hand. 18-year-old female. Nice to see Kistiji, Meghavi, Shweta, and many more who are all online. Found dead by suicidal hanging. What could be the possible method of death? Once more, Liklo. Hanging versus strangulation. Strangulation. Asphyxial death is a standard topic అమ్మా ఫారెన్సిక్లా ఒక 2 పేరాగ్రాఫ్లు ఉంటాయబ్బా అది చదవకుండా నువ్వు గనక నేను అది చదువుతా ఇది చదువుతా అంటే నడవది ఆ 2 పేరాలు చదివినవా అది ఇంపార్టెంట్ అర్థమైందా హ్యాంగింగ్ వర్సెస్ స్ట్రాంగులేషన్ ఆస్ఫిక్సియల్ డెత్ ఇది అయిపోగానే మీరు కూర్చుని గర్మాగరం చదివేసేయండి నైట్కి అది కూడా నా చదవమంటే ఇంపాసిబుల్ మీకు గుర్తుండదు అందుకోసం మనం ఈరోజు సజెషన్ తీసి బర్న్స్ అమ్మ బర్న్స్ లేకుండా ఉంటుందా బర్న్స్ తప్పు పెట్టినోడు అంత నీచుడు నికృష్టుడు ఎవ్వడు లేడు అంగాయిష్కులు అష్ట విక్లబులు అష్టారోగ్య భాగ్యుల్ దరిద్రుల్ ద వరస్ట్ ఫెలో ఈస్ ద వన్ హూ can't answer even Burns question. Bolo, percentage of burn kitna hai? 15 to 20% if you know the formula. Parkland formula, everything burns amma. Okka question burn paper burns. NEETPG paper burns. You don't need more than 7 days of preparation. After March 5th, our program starts next year, 7 days before only. Right. Type of hymen shown in the image. This is red light area question. Impossible. वहां आप think करके septate uterus है because there is a septum. It doesn't need preparation. मैं क्या बोल रहा हूँ ना? If anybody asks you, are you preparing for NEETPG? No, it doesn't need preparation, sir. You just need 100 topics. I know where are they coming from. The surgeon took alcohol before going to surgery. Patient died. What is the type of negligence? Criminal negligence. Raskondi jara. It is standard topic. Civil negligence, criminal negligence. Negligence is a forensic standard topic. 11-year-olds, 10 to 15 tablets of ferrous sulfate. What is the antidote? మళ్ళీ ఇంకొకటి ఎన్ని వచ్చినాయి యాంటీడోట్లు 3 యాంటీడోట్లు వచ్చినాయి एग्जामिनर इतना बार एंटीडोट 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 बोल रहे हैं एक डिगॉक्सिन टॉक्सिटी एक पैरासिटामोल टॉक्सिटी और एक आयरन टॉक्सिटी और एक ఫోమెపిజోల్ का somewhere related no మరి యాంటీడోట్ లేకుండా ఎట్లుంటుందప్పా రేపు కూడా ఉంటుంది నెక్స్ట్ వీక్ ఉంటుంది యాంటీడోట్ చదవకుండా నేను అది చదివినా ఇది చదివినా ఓ ఊర్లో అన్ని చదివినా అంటే ఏడైతే కాదు యాంటీడోట్ తప్పు పోదు टड़न टड़न डिशुम 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 फायर आर्म इंजरी एक बुलेट मारेगा एग्जामिनर आप कैसे आंसर करना बुलेट के जैसे राइट फायर आर्म इंजरी 5 or 6 paragraphs in the notes I gave you in forensic 5 मिनट से ज्यादा नहीं लगेगा आपको पढ़ने के लिए राइट सो पिस्टल इज एन इंटरमीडिएट रेंज मेरी जिम्मेदारी अगर ये टॉपिक्स मैं एट द एंड ऑफ एनालिसिस 400 टॉपिक्स देता हूं ना 400 टॉपिक्स के बाहर अगर वो 100 क्वेश्चंस गए तो 100 क्वेश्चंस मिनिमम नहीं आए तो आई विल होल्ड माई सेल्फ रेस्पॉन्सिबल अंडरस्टैंड प्लीज ट्रस्ट मी बिलीव मी एंड एंजॉय प्रिपरेशन द लास्ट मोमेंट थोड़ा विज्ञता का इस्तेमाल करो broken vaccine vials are discarded in color of the bag या डाउट इच नहीं कलर ऑफ द बैग नहीं पड़ा मैं ये कोचिंग गया वो कोचिंग गया बोले तो कोई भी सुनता नहीं मम्मी डैडी का पैसा बर्बाद कर रहे हो ब्लू 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 at urban PHC ANM is given 1 vial 2 vials of MR vaccine both are already open they're all in the cold chain requirements are still intact what will you do use pentavalent and discard MR vial. BCG, measles, MR, MMR, rubella are equally sensitive to light as well as to heat. MR is heat sensitive especially after reconstitution. क्या लिखोगे आप वैक्सीन्स UIP వ్యాక్సిన్స్ యూనివర్సల్ ఇమ్యునైజేషన్ ప్రోగ్రామ్ తప్పు పెట్టిందంటే క్షమించడు మెనీ చిల్డ్రన్ ఫ్రమ్ పర్టికులర్ కమ్యూనిటీ కమ్ విత్ మేనిఫెస్టేషన్స్ ఆఫ్ ALL if a case control study has to be done whether the chemical and ALL are associated who is a control who is the case chiller question but still liklo case control versus cohort ఇప్పుడు కాదు నేను పుట్టక ముందర నుంచి అడుగుతూనే ఉన్నాడు ఎగ్జామినర్ ఇదే క్వశ్చన్ ఫర్ అప్లైడ్ న్యూట్రిషన్ ప్రోగ్రామ్ సీడ్స్ అండ్ మెన్యూర్ సప్లైడ్ అండర్ స్కూల్ హెల్త్ సర్వీసెస్ हैव बीन डन बाय whom UNICEF ये स्टैंडर्ड नहीं है चिल्लर नहीं है रेड लाइट है क्योंकि आप गेस करें तो राइट गेस मारे तो कॉन्डोम सक्सेसफुल अदरवाइज ब्रोकन कॉन्डोम आशा आशा हमारे नीट पीजी का आशा है जरा क्विकली लिख लो आंगनवाड़ी वर्कर आशा ये दोनों को जो नहीं पढ़ के गया निराशा मिलेगा राइट सो प्लीज रिमेंबर 1000 to mother 400 to आशा then next మళ్ళీ ఇదొక నువ్వు టైం పంచాక మొదలు పెట్టద్దు ఏమైంది you can on the YouTube and listen but thanks that you came right are you okay with this analysis good criteria to establish urban CHC to ensure facilities include amma red light area question पढ़े तो भी नहीं होगा कहां तक पढ़ोगे गवर्नमेंट का पॉलिसीज को आप डिस्ट्रिक्ट कलेक्टर होना है उसको भी मालूम नहीं छोड़ो a cohort study is being odds ratio is found to be 0.85 What is true about odds ratio? This is standard. लिख लो. T score, I mean T test, student T test, odds ratio. షూర్ అండి. ఇది చదవకుంటే వేస్ట్ అండి. మీకు తెలుసుగా ఇవన్నీ డిస్క్రిట్ వేరియబుల్, కంటిన్యూస్ వేరియబుల్, వేర్ డు వి యూజ్ వెన్ వి క్యాలిక్యులేట్, తెలియదా? మళ్ళీ ఇది ఒక ప్రాబ్లం. ఓ పోనీ सी दोस टॉपिक्स. आप एक काम करो, मैं भी आपके लिए काम करूंगा, आप भी मेरे लिए काम करो. जो टॉपिक्स यू फील यू can't read yourself, I will bear that surrogate pregnancy. చదువుతారా? ఒక 5 పాయింట్స్ ఉంటాయి. ఆడ్స్ రేషియో ఇది. స్టిల్ ఇఫ్ యూ ఫీల్ मेरा सत्संग भाषण की जरूरत है तो बोलो. स्टूडेंट टी टेस्ट, chi square, odds ratio, chi square, student t test. Sure short question. WHO stepwise approach includes रेड लाइट एरिया क्वेश्चन. एसपीएम में ज्यादा रेड लाइट होता. आप ये एक बात याद रखो, क्योंकि वहां एग्जामिनर एक्सपेक्ट्स यू टू बी नेचुरल आंसर इट एंड यू विल बी टेम्प्टेड. मुझे मालूम है भाई, WHO मालूम है ना, स्टेप बोले तो मालूम है ना, और डिस्को स्टेप्स मालूम है ना, फिजिकल समझ में आता, मुझे साइकोलॉजिकल समझ में आता. लेट मी ट्राई बोल के आप पूरा पैंट को सेट करके निकलेगा. कथा रिट्रोवायरल पॉजिटिव, बी श्योर. స్టెప్ వైజ్ అప్రోచ్ అని ఏదో ఉన్నది, అది తెలియాలి. తెలియకుంటే బాధపడక్కర్లే, ఎవరికి తెలియదు అది. सब लोग एक ही लेवल पे है. Since 3 weeks was started on ATT under NTEP. When do you call treatment completed, cured, improper follow, failure, standard? भैया इसको रॉन्ग आंसर करे तो जरा भगवान भी माफ नहीं करेगा. तो इसलिए क्विकली जाके ATT और नेशनल ट्यूबरकुलोसिस प्रोग्राम इज द स्टैंडर्ड थिंग. इसको पढ़ने के लिए आपको 10-15 मिनट लगेगा, कोई बात नहीं, बट यू इन्वेस्ट द टाइम, इट इज वर्थ, बिकॉज एग्जामिनर स्टैंडर्ड प्रोटोकॉल इज 1 question on national tuberculosis program. बराबर. So case definitions in TB treatment, what are the diagnostic modalities, oh ये सब मस्त डिस्कस रिवीजन करना. Good to see 43 online classmates. So हमारे सारे दर्शकों को हम स्मार्ट वे 7 days में हाउ टू क्रैक एग्जाम उसका प्रयत्न कर रहे हैं. Most logical and cost-effective approach to control rabies in urban population. Remove the stray dogs and give the vaccine. इसको क्या बोलते हैं? पढ़ने से आने वाला चीज नहीं होता, बिस्किट होता. और दूसरी बात क्या है? रेबीज वैक्सीनेशन. लिख लो, नेक्स्ट एंट्रेंस में आएगा. डिफरेंट रेजिम्स आर देयर, नो, प्री एक्सपोजर, पोस्ट एक्सपोजर, वेटरनेरियन. ऑलरेडी एक बार कुत्ता काटा नीट पीजी हो गया, और एक बार कुत्ता काटा फिर नीट पीजी हो गया, उसको क्या दोगे? तो रेबीज वैक्सीनेशन पढ़ लो, क्योंकि एग्जाम के क्वेश्चन बैंक में बैठा है. Things you will not do as a medical officer of PHC when posted in earthquake area. You don't run away with the nurse. So, what is your answer? लोग आपको सिखाएगा, आप लोगों को नहीं सिखाओगे. ये क्या होता है? बिस्किट क्वेश्चन. This does not come under. Don't tell daddy. If you try to go and explain them, about education, public will say, don't teach daddy how to produce babies, right? Get out, bolega. Lifespan of Japanese women is 84.3, and she has the qualis, हालीस, डेलीस, ये सब तो पूछेगा. लिख लो HAL, DAL, and HDI, PQLI. एक क्वेश्चन जरूर आएगा.
Quality adjusted life expectancy.
I'm not going to discuss. Answer disability adjusted life expectancy.
No, sir. Why, sir?
Lifespan is 84. As Japanese have longest life expectancy, their life expectancy are used as standard for measuring the disease burden in. ఒకవేళ వద్దు మాకు ఇక్కడ ఏంది చెప్పి ఈ వేళ ఓకే కదా డిజబిలిటీ అడ్జస్టెడ్ लाइफ ईयर्स मगर मगर अम्मा जरा शांति से 10 मिनट आपके जिंदगी का टाइम को डेली हाली क्वाली यू कंप्लीटेड है गुड गुड మళ్ళీ ఈ వేళ ఆ వేళ అంటే which type of cell signaling ये तो हमारे 8th क्लास क्वेश्चन है बिस्किट व्हाट इज पैराक्राइन एपोक्राइन एंडोक्राइन मीरोक्राइन कोई आके टीच नहीं कर पाएगा आपको You have to call your biology teacher in 11th class. Quota classes को जाना पड़ता. Which feedback process is involved below? Too much. This is red light area question. A negative, देखने में negative लिख रहा है, मगर ये negative positive, maybe I don't know. But still, this is a calculated risk. Condom पकड़ के जाने वाला question है. You can take risk. You don't lose. अगर लूज है तो 1/4 चलेगा मगर ट्राई करे तो राइट हुए तो नेगेटिव फीडबैक. दिस इज अनदर रेड लाइट एरिया क्वेश्चन. सिस्टोमेट्रोग्राम किसको मालूम होता है? सिस्टोमेट्रोग्राम उसको ही मालूम होना है, ब्लैडर को तो छोड़ दो. देन OPD with complaints of paresis, numbness after sleeping on the arm. This is our favorite now. Nerve fiber classification. लिख लो. Nerve fiber classification, which are unmyelinated, which are myelinated, which will rapidly conduct, which are sensitive to pain, hypoxia, local anesthesia, pressure. वो ये तो औरंगजेब के पिताजी प्रिपेयर होने वाले जमाने से पूछ रहे हैं. Now, which event occurs during the phase B to raise body temperature of the hypothalamus set point? छोड़ दो, मेरे बस में नहीं होगा, ये पढ़ना भी मुश्किल है मेरे जिंदगी के लिए. Red light area question. Don't try it also, this kind of question. Because you just need 150 correct with 50 left, no red light area questions. So red light area को identify करना important है डॉक्टर. Identify the investigation in the image given. ये तो बिस्किट में बिस्किट क्वेश्चन है. अमूल बिस्किट. Middle-aged male, acute onset of pain in the right limb. What is the name of the investigation which is being shown? अरे क्या ये अल्ट्रासाउंड डॉपलर मालूम नहीं है तो you have done in Azerbaijan medical school. Then 35-year-old female presented fever, expectoration, difficult breathing, HRCT was performed. What is the most likely diagnosis? Air bronchogram. If you recognize, great. If you don't, समझ में नहीं आ रहे आपको, क्या ऑप्शन दिया देखो. डायफ्रामेटिक हर्निएशन दिखने में मे बी दिस इज हर्निएटेड डायफ्राम दिखता. प्लूरल एफ्यूजन, यू डोंट नो, बेटर नॉट ट्राई, कुछ भी नहीं होता. Patient with this nail findings, irregular pitting, what is your diagnosis? Oil drop sign of psoriasis. लिख लो. Psoriasis, standard question. Without that कभी होता ना, पेपर नहीं होता. बराबर. मगर in the last 7 days आप psoriasis touch किया या नहीं किया, important, right? हाँ, touch किया, क्योंकि recently मैं dermatology बक के थक गया. तो female patient with hair loss, thinning since 4 months, as shown in the image. Alopecia के बिना होता क्या पेपर? It is a telogen effluvium. So alopecia लिख लो is standard topic. आज हम पढ़ा या नहीं. स्कारिंग एलोपेसिया कॉजेस, नॉन स्कारिंग एलोपेसिया कॉजेस, वो सब पढ़ा या नहीं? वो अपने आत्मा आत्म को पूछो. 26-year-old comes to OPD with anogenital warts. Which HPV is it? What is the standard topic? Click low. HPV 18. Type 6 and 11 are condyloma acuminata.
6 and 11 are. That's 11 only. 18 are answer. Sir, answer tappo.
Anogenital what? No.
11. 16, 18, 16 squamous cell, 18 adenocarcinoma.
అవునా? ఒకసారి మనం రీచెక్ చేయండి. ఓకే, అగ్రీ. కానీ వాట్ అయితే స్టాండర్డ్. నెక్స్ట్, రెడ్ పిగ్మెంట్ ప్రొడ్యూసింగ్ పెన్సిల్ షేప్డ్ మ్యాక్రోకొరిడియా. But still, what is the standard one? Trichophyta. HIV patient with breathlessness fungi which are dimorphic in morphology. अम्मो మనం ఎప్పుడు వినని కూడా వినలే. టెలెరోమైసిస్ మార్ఫెనియే, इसको रेड लाइट में डाल दो, डोंट वरी. बट स्टिल आप डाइमॉर्फिक फंगई एक बार इज अ स्टैंडर्ड टॉपिक, वो लिख लो. वो एक बार उसका दर्शन कर लो. लिस्ट ऑफ डाइमॉर्फिक फंगई, ऑब्ट्यूस एंगुला, वो सब उसी में आता. Patient presented with history of recurrent sinusitis, fungus or dichotomous branching less than 45 degrees aspergillus. ये तो मुमताज के लिए ताजमहल बनाने के पहले से ये हो रहे थे. यही क्वेश्चन पूछा. aspergillus acute angle, broad based blastomyces, broad based budding yeasts are blastomyces. Cardi white discharge, come on, biscuit question. Canada ka mala, this is a red light area question. The culture, these many culture, red light, don't worry. Don't tempt because you know Canada. I know you are from Bombay, I am from Bombay, let's go together for a cup of tea. Gone. Right? Then a farmer, a lot of times temptation in it. One of the common questions asked by many students is how to decide which question to answer, which to not. Lot of times teachers say, मुझे क्या मालूम है, आपको क्या मालूम या क्या नहीं मालूम, आपको मालूम होना है. But that is not correct. If you feel I am going beyond a limit of my pay scale to try to answer that, don't do that. Right? There's a very famous dialogue in Hollywood movies in a bank robbery, no? What is that? Yesterday only I was watching a bank robbery movie. Do you want to be a dead hero or a live coward? He will put the gun on one of the guy in the bank. Do you want to be a dead hero or a live coward? Then don't try to be smart. Kneel down, he will say, and then robs the bank. So, yeah, this is true in NEETPG. Don't become a dead hero. Be a live coward and say no to the questions which you are beyond your pay scale. Right? So, if somebody told that elimination method, culmination method, estimation method, bakwas ka YouTube videos रहता, how to use to answer. You try all that. HPV 16 guaranteed. Right? No elimination, culmination, estimation. आपके आत्मा से पूछो, मेरे बस में होता है या नहीं होता? A farmer presented granules are crushed and examined. Granules are crushed and examined. So it is about mycetoma. Please लिख लो, mycetoma, Madura mycosis, standard topic of the examiner. A woodworker presented with chronic localized infection of the skin in the lower limbs and feet. and a bud was shown, which was chromoblastomycosis, right? So all dimorphic fungi, doctor, basically histoplasma, blastomycosis, rhinosporidiasis, then aspergillus, मधुरा माइकोसिस. एक क्वेश्चन आएगा आपके माइक्रोबायोलॉजी में लास्ट में, जरा पढ़ के जाना. 5 मिनट से ज्यादा नहीं लगता. कॉपर पेन्नी बॉडीज, so typically are seen in that only. Then what is the best way to diagnose Clostridium associated? Once more, लिख लेना. Clostridium is a very high yield topic. Not now, from times immemorial. Tetany, botulinum, difficile. వన్ ఎంసీక్యూ ఇన్వేరియబుల్లీ మీరు తీయండి. నేను మీకు లిస్ట్ ఇచ్చిన కదా, మైక్రోబయాలజీలో క్లాస్ట్రిడియం ఉంటుంది, 7th టాపిక్ 8th టాపిక్ ఉంటుంది. అది ఇప్పుడు చదవాలి, బుర్రమని చదివిపోవాలి పరీక్షకి. 24-year-old male recently returned from Africa. अरे अफ्रीका से आए तो कई को पूछा NEETPG में, out of syllabus. Tore his bodies. Which strain of vaccine must be given? Fundamentally, what is this? This is vaccines topic का है. Little applied question. Vaccine anyway is our standard topic. Police officer admitted with fever and myalgia, body lice. What is the ఒక్క rickets రాకుండా ఉంటుందా? Best explains the rash. Rickets professor की rickets లిస్ట్ ఉంది కదా, which rickets, lice, tick, eschar present, eschar absent. Every time we think we want to read that, but we don't read and go. But that is one buttifiable topic, right? Then doctor, a newborn HIV diarrhea. What is the organism? How will you? HIV लिख लो. Definitely one question will come from HIV RNA PCR. One question on microfilaria, doctor. Every INA-CET जाओ, कहीं भी जाओ, 3 organisms के बारे में एग्जामिनर पूछेगा. लोवा वर्सेस filariasis में 2 types are there, Buergeria bankrupti and ब्रुजिया मलाई. ये तीनों का टेल कैसे होता है, हेड कैसे होता है, कितने आंखें होता है, कितने anal openings are there? Examiner is obsessed, right? You need to be very sure. Brugia mali versus Buergeria versus lova and oncocerca for that matter. River blindness is there, no? वो standard topic list में डाल दो. The woman with clinical history of diarrhea, broad spectrum antibiotic. About Clostridium difficile. Once more, 2 questions in same exam on Clostridium difficile. Amoxicillin. Often clinical history of lung disease, broad acetate hyphae invading blood vessel. Amphotericin B for aspergillus. Aspergillus आपके लिस्ट में है, 2 बार आ गया. और एक बात क्या है अम्मा? Amphotericin B, Grisofulvin, echinocandins, antifungals. Antifungals. ఏమైంది? అవును, యాంటీబయాటిక్స్లోనే ఇచ్చేసినాం. యాంటీఫంగల్, యాంటీవైరల్, ఎవ్రీథింగ్. అది రోజు చదవాలి, తప్పదు. లాస్ట్ 7 days యూ నీడ్ టు రీడ్ దట్. कितना मे बी अबाउट 7-8 पेजेस का नोट्स दिया मैंने. యాంటీబ్యాక్టీరియల్, యాంటీఫంగల్, యాంటీవైరల్ క్రాష్ కోర్స్లో కూడా రివిజన్ చేసిన. ఉపయోగం ఉంది, అయినా కూడా మీరు టెన్షన్ పడుతున్నారు. ఇఫ్ ఎనీబడి టాక్ టెన్షన్, ఐఎమ్ నాట్ గోయింగ్ టు ఎక్స్క్యూజ్ యూ ఫర్ ద కైండ్ ఆఫ్ intensive coaching I gave to you. You are going on non-specific topics too deeply where it is not needed. Are you preparing for PhD or for MD? Be sure, doctor. Come on. पूरा साल अच्छा पढ़ के लास्ट हफ्ते में 10 दिन में खराब करने वाले को सैकड़ों को देखा मैंने, राइट? To measure the effect of successful treatment, what is the best way? Monitor the viral load. Once more, HIV. कितने आ गए HIV के बारे में अभी तक? 2 मर्तबे आए एक ही एग्जाम में. मतलब examiner is itching to give a question. Acute onset of stroke developed proximal ballistic movements of the limbs, which is hemibalismus, which is subthalamic. So मैंने क्या बोला? Parkinsonism is a high yield topic. Parkinsonism में कोरिया होता है, right? So all movement disorders come under that umbrella. Parkinsonism में. So standard. Recurrent chest infection, abdominal pain, history of one transfusion, HbA2 increased, HbF increased. Once more, how many questions came on thalassemia? 2. That means in your 100 topics, which is going to save your life, कुछ टॉपिक्स के ऊपर 2 बार 3 बार भी पूछ रहे एग्जामिनर, लाइक टीबी, HIV, thalassemia. Then where is the special coaching required for you guys, man? ECG done is being shown to you. Chest pain, palpitations, wide complex QRS. So it is VT or SVT?
VT.
But it's not. So you should know SVT, VT. What is the treatment algorithm? How to identify that on ECG, which we already read. So SVT, VT. पढ़ोगे ना? A patient presented with anorexia, jaundice, right upper quadrant pain, investigation show HPS positive and anti-HPS AG negative, IgM, HBC. लिख लो, hepatitis B serology, hepatitis C virus. नहीं पढ़ के गए तो एग्जामिनर छोड़ेगा. Hepatitis virus, hepatitis, all hepatitis, which is DNA, which is RNA, everything. 100 questions over. इसलिए बस है. Are you done? अरे నువ్వు నీకు బిజీ అని ఎవరు చదవద్దా? బీ కేర్ఫుల్. ఇచ్చినావమ్మా, ఇస్తే నువ్వు చదవాలి కదా. ఇగో నువ్వు వినీష్ అడ్వైస్ విన్నావంటే ముందుతో ఏం లేదు. See, come on, tell me what is the list of homework. फटाफट गड़ागड़ बोलो. అరే నువ్వు గడగడ చదవబ్బా. నువ్వు లిస్ట్ చదవడానికి టెన్షన్. గట్టిగా చదువు. supracondylar fracture, bone tumors, humerus, axillary nerve injury, Galiagi, Montigi, tetanus toxin, botulinum toxin, and all toxins mechanism. Antidotes in poisoning. Migraine, all headaches, cluster headache, migraine headache, tension headache, digoxin toxicity, tricyclic antidepressant toxicity, lithium toxicity, hypertension drugs, monoclonal antibodies list, DKA, hypoglycemic drugs plus insulins. Oral hypoglycemics and all types of insulin, bromocriptine, Parkinsonism drugs, thrombolytics, anticoagulants, antiplatelets, asthma drugs, antiemetics, all antibiotics classes, mechanism of action, side effects, fluoroquinolones, aminoglycosides, tetracyclines. Pado.
TB, sir. Everything about TB.
Everything about TB, definitely, because how many questions came on TB in NEETPG? Single paper में 3 आया अभी तक.
Potassium, calcium, magnesium, sodium, all hyper and hypo.
Hyponatremia, hypokalemia, hyperkalemia, hypocalcemia, hypercalcemia, hypomagnesemia, hypermagnesemia. ECG में क्या होता, causes क्या होता, treatment क्या होता, नहीं पढ़ के गए तो examiner band बजाएगा. Next. So online students, please be part of our WhatsApp study group. संत मितना जी ने ये पूरा लिस्ट आपको भिजाएगा. So please say thumbs up for sharing the list, but पढ़ के आना कल के क्लास को. So all right, फटाफट. Next.
Drugs of all systems.
Drugs of
all systemic drugs.
How many systems? Rheumatology, endocrinology, hematology, renal, GIT, neuro, cardio.
Respiratory, cardio.
तो इन सब में एवरी चैप्टर में लास्ट में 2 पेजेस हमने ड्रग्स के लिए डेडिकेट किया. वो लिस्ट पढ़ लो. राइट. नेक्स्ट.
Pedigree, sir. Inheritance patterns. Pedigree charts.
Inheritance patterns. Autosomal dominant, autosomal recessive, X-linked dominant, mitochondrial inheritance. उसका pedigree को identify करो और what are the causes. One question pocket में रहता. Next. All anemias. Iron deficiency anemia, sideroblastic anemia, thalassemia.
And
all leukemias. AML, ALL, CML, CLL, HCL, which is hairy cell leukemia. Hodgkin's lymphoma, non-Hodgkin's lymphoma. Saptarishis. 10 points about each of them and 7 into 10, 70. लगेगा आपको 20 मिनट से ज्यादा नहीं. Next. Glomerulonephritis, FSGS, NPGN, type 1, type 2, lupus nephritis, membranous nephropathy, minimal change disease, pado, and also diabetic nephropathy, Kimmelstein, Wilson solutions, etc. Next. Thromboelastography. Dumb topic, but examiner love it like anything. I don't know. Thromboelastography shapes. Wikipedia में पढ़ो. Next. Nasopharyngeal angiofibroma, male with epistaxis. Khatam. Weber-Rini bone conduction, absolute bone conduction. खत्म करो. One question आएगा. ASOM, CSOM, serous otitis media के बारे में नहीं पढ़ के गए तो एग्जामिनर कैसे क्षमा करेगा. Next.
Pinkish, flamingo-pink, RU.
That's newly added.
After tympanic membrane.
Achha, tympanic membrane. No, that yeah, will come.
Metal poisons. All metal poisons.
All metal poisons. Thallium, mercury, lead.
Then we have wounds in forensic. Forensic wounds, sir. Wounds.
Wounds in forensic. If you don't, examiner will wound you left and right.
Then
and
firearm injuries, sir.
Firearm, dishum. आप नहीं बोला? Suicide versus homicide. Come.
Suicide versus homicide.
Suicide versus homicide.
Hanging versus strangulation.
Hanging versus strangulation and all asphyxial death. Definitely a question आएगा NEETPG में.
Next, so we jumping in Burns law, degrees, rule of 9, Parkland formula.
Asal, everything on burns. First degree burn, second degree burn, Parkland formula, child may burns, Wallace formula, how will you give fluids, what are the complications, silver sulfur diazine, will you apply or not, if you apply, what is the distal metabolic alkalosis, can occur, सब कुछ पढ़ना.
Civil and criminal negligence. Civil and criminal negligence.
Civil and criminal negligence.
And then waste management.
वेस्ट मैनेजमेंट. ये बैग क्या कलर है, वो बैग क्या कलर है, फ्लिपकार्ट का लोगो क्या है, सब कुछ. केस कंट्रोल वर्सेस कोहॉर्ट. आंगनबाड़ी आशा वर्कर्स एंड सब सेंटर PHC CHC कहाँ लगाओगे, कितने पॉपुलेशन को लगाओगे, उसमें क्या होता है, कॉलिंग बेल होता है या नहीं होता, डॉक्टर्स कितने दिन जाना है, रोज जाना है, मगर या नेक्स्ट
odds ratio
हाँ
odds ratio sir odds ratio odds ratio t student
हाँ odds ratio student t
square
हाँ
square
chi square test अबे ओपन करो 1200 pages notes या any notes wherever you took coaching open करो revision करो अम्मा next vaccines इन नहीं vaccine how many questions come two से भी ज्यादा और another 100 questions है 4-5 होता है हाँ
next indicators of health sir
quali dali hali PQLI HDI next nerve fiber calcification, which is unmyelinated, A type, A alpha, A beta, A gamma, B, C, yeah. Psoriasis in dermatology, sure shot. Alopecia, sure shot. Trichophyton, sure shot. All dimorphic fungi. Mycetoma, Madura mycosis. Rickettsial, everything about rickettsial. One question, rickettsial, Jeru, Raiga, tetracyclines are the ones which are used. Then HIV, at least 3-4 questions will come from HIV. Kal bhi aaya, aaj bhi aaya, kal bhi aayega. Also, HIV. Antiretroviral therapy, NRTIs and NRTIs, Enfortide, Buttide, everything. Then microfilaria में loba loba, Bridgemalaye, Ucuraria Boncrafty, how the larvae look like, कितने आंक रहता, कितना खान रहता, सब कुछ. Antifungals, echinocandins, greaseofulvin, amphotericin B, everything, their side effects, mechanism of action, how do they differ? One MCQ invariable. SVT and BT, ECG treatment. Huh? SVT and BT. SVT versus BT, ventricular tachycardia, supraventricular tachycardia, ventricular fibrillation, atrial fibrillation. Next, hepatitis virus serology. All about hepatitis, HBV, HCV, HIV, HDV, HEV, and what are the serological patterns? When do you call acute infection, chronic infection, recovering patient, actively replicating virus, everything. Khatam? Enne mottam? 50, sir. Huh? 50 topics. 50, yeah? Yes, sir. 100 questions discuss किया. हाँ, around 50 निकला. हाँ. Another 100 discuss करे so another 50 निकलेगा. So first एक पेपर डिस्कस करते ही हमको 100 मिल गया खाने के लिए चीज. Another 3-4 papers we discuss, we know what examiner is going to ask. Are you all ready? Do you think 7 days is too much of time to read these 400 chiller topics? Right? You hardly take 5 minutes time. So tension के बारे में मुझे मत बोलो. Do you want to take a break? 9:33. సరే ఒక పని చేద్దాం, రేపు మొదలు పెడదామా? అవి చదవండి, అవి ఖతం చేయండి అధ్యక్ష. మిగతావి కల్ సుబా कल जरा हमको कितना देर लगा एक 100 क्वेश्चंस खत्म एनालाइज करने के लिए? 1 hour ना? 1 hour. Very good. So remember, so what I like to tell all the online students is मजे में पढ़ाई करो. हमको कितने पेपर्स डिस्कस करेंगे? 20, 22, 21, 20, 19, 18. 5 into 200, 1000 क्वेश्चन एनालाइज करेंगे. इसके लिए 10 घंटे हम खाली एनालाइज करने के लिए बैठोगे मेरे साथ. Then 10 papers of AIMS / INICT. कितना हो गया? 2000 क्वेश्चंस. मतलब 20 आवर्स बैठोगे मेरे साथ. So by the time you analyze this only, you will get around 500 topics to prepare. And you are justified why you are preparing, because that is what your exam you are going for, not to get PhD. And this will be more or less repetition from this 500. And tomorrow when you go for the exam hall also, you know what to anticipate. You won't be stunned to see the dirty red light questions, which is impossible to answer. And आराम से आके बोलोगे, sir, I did 160 correct out of 200 in this 1 week, thanks to Kaushik. Yeah. So thank you all. See you tomorrow, and we'll work with our मजे में पढ़ाई करेंगे. So Kamini is saying, sir, please request Mithuna to send the today's list on WhatsApp group. Already sent her? Good. That's good.
Sir, I have put in Super 30. I don't know if there is any other group.
No, उधर से पूरा देश को जाएगा. Internationally, we will distribute them all. So thank you all. Tomorrow, I will let you know. But please, after going home, आज के 50 टॉपिक्स को आप ऑनलाइन में मीट होगे या कहाँ मीट होगे मुझे मालूम नहीं, जूम में मीट होगे, बैठना, पढ़ना, खत्म करना, नहीं तो कोई एक पकड़ के नोट्स फटाफट बोलो, पॉइंट्स डिस्कस करो जैसे यहाँ कर रहे हैं. ठीक है. थैंक यू.